Hello, everyone. I'm not sure if you can see me. I'm a little short for this podium, so, but I'll try my best to try to make some eye contact. So, as Millie mentioned, my name is Zahra Ismail, and I'm the Program Manager of Psychosocial Oncology, Patient Education, and Nursing at Cancer Care Ontario. And I'm here to tell you a little bit about the initiatives underway that speak to CCO's approach of cancer as a chronic disease. So I'm not sure how familiar you all are with CCO, so I just want to start by giving a little bit of background on Cancer Care Ontario. So CCO is a provincial agency responsible for improving cancer services and really acts as the advisor to the Ministry of Health in all things that are related to cancer. CCO directs a budget of over $800 million, and that's spread across cancer, the Ontario Rail Network, and access to care. And our mission is to improve performance of the cancer system by driving quality, accountability, and innovation in all cancer-related services. This is an overview of the Ontario Cancer Plan 3. How many of you have seen this before, this slide? Can I get your hands? Okay. Not as many as I thought. There's this tendency of CCO employees to kind of show this slide again and again on every single deck, so just curious. And so the OCP3 is, and the reason we show it so much is because it's our strategic roadmap that outlines where we're going from 2011 to 2015. And it has our vision, our mission, but it also defines our high-level goals and guiding principles. It identifies 6 strategic priorities, all of which relate to approaching cancer as a chronic disease. And these 6 priorities are to develop and implement a focused approach to cancer risk reduction, implement an integrated screening program, continue to improve patient outcomes through safe, accessible, high-quality care, continue to assess and improve the patient experience, develop and implement innovative models of care delivery, and expand our efforts in personalized medicine. I'll be providing some specific examples of work that relate to each of these priorities later on in my presentation. So this is a draft of our new Cancer Journey infographic. And if you're familiar with our old infographic, it just kind of had that middle portion. So going from prevention, screening, diagnosis, treatment to recovery or end-of-life care. Now this is still a draft version, but this was partially informed by feedback from our patients saying that, well, one, recovery is more than, it shouldn't be just called recovery, it could be survivorship as well. And second, also, it's us thinking about palliative care in a different way. So before, palliative care was thought about as more sort of end-of-life care, and there's a movement towards thinking about palliation earlier in the journey because symptom management is really important in different phases of the cancer journey. So now palliation is kind of spread across the bottom, and it goes from diagnosis, treatment, recovery, survivorship, and end-of-life care. And as you can notice, it doesn't say just palliative care, it includes psychosocial as well. And that's the sort of increasing recognition of the importance of psychosocial care for the patient and thinking about the patient as a whole rather than just, the organ that we're trying to treat with radiation or chemo. Across the top, you can see the addition of a new bar, and that's the primary care bar. And the reason that was added was, again, the recognition that primary care has a really important role in the cancer system. And sorry? Huh? Yeah. We're happy with this too. And it has a really important role in the cancer system, especially as cancer patients are living longer with cancer. So this is right now just a draft. We're still kind of refining this and vetting it with different groups, but it really speaks to how we're thinking about the cancer journey a little bit differently. So I wanted to really frame my presentation and the work that CCO is doing within the context of chronic disease prevention and management. And so this slide actually lists some of the components of a successful chronic disease prevention and management program. And I thought I would sort of structure the different things that CCO is doing, like my talk about the different things CCO is doing in relation to these different components. So I'd like to begin with evidence-based. Those of you that are familiar with CCO know that CCO has a very strong culture and a long history of evidence-based medicine. CCO established the program for evidence-based care in the early 90s, and it's a program that's based out of McMaster University, and they create many guidelines on a variety of topics. And one such guideline is psychosocial health care for cancer patients and their families, which I'm sure many of you are familiar with. And this guideline outlines 8 domains that are important for effective psychosocial care for cancer patients. And at CCO, we're in the process of implementing this guideline through our regional PSO leads. And we're taking a phased approach to this implementation. We're working with the leads to identify activities that address each of these domains, and then would like to try implementing a couple domains per year up until 2015. And the aim is, by 2015, that we'll try to improve the standardization of psychosocial resources across the entire province. Multiple approaches is another important component of a chronic disease program, and it speaks to using different methods and providers to facilitate chronic disease prevention and management, or in other words, looking at new models of care, which is, as I mentioned earlier, an important strategic priority for CCO. And an example of CCO using multiple approaches is the establishment of the primary care program. Now, I don't work in primary care, and I know there's some sort of experts here who can speak more expertly to the primary care program. So I'm just going to give you a quick overview of what they're up to, and I'll let others speak to this in more detail. So the primary care program was established more recently, and one of their key initiatives is their engagement strategy. And the engagement strategy was really designed to further integrate primary care providers in the cancer system, and this started in the screening phase of the journey and sort of increasing screening rates, but then has really spread along the other phases of the journey. And to this end, they have also established a network of provincial and regional members. Another program that's related to looking at new models of care or multiple approaches is the Survivorship program. And with increasing incidence and prevalence of cancer survivors, which is a great thing, there is a need to examine the way well follow-up is provided for cancer survivors. Traditionally, cancer survivors were followed up by their oncologists, but there's evidence that shows that devolving well follow-up from oncologists to primary care is beneficial for the survivors themselves, and it also allows oncologists to have more time for patients who are on active treatment. To be able to change this model of care, we had to look at creating some guidelines and also launching some pilots. Their well follow-up guidelines were completed for colorectal cancer, and there's some in progress for breast, lung, and prostate. There's quite a bit of literature on breast cancer well follow-up. So survivorship clinics for breast cancer were put in place across the entire province. So there's 14 across the different LHINs. And we've started with some colorectal demonstration projects. And the idea there is that colorectal cancer follow-up was a bit more complicated, and we wanted to do sort of a demonstration in a few regions, so 3 sites, to be able to build the evidence and transition these patients out from the from the regional cancer centers to primary care providers in an appropriate manner. Both projects, the breast cancer models and the colorectal demonstration projects, have identified key elements that make these models effective. And those include things like an increased scope of practice for general practitioners or advanced practice nurses, creation of care plans with the patients, and allowing for rapid reentry back to specialists if there is a recurrence. Also, there's a need to sort of measure the patient and provider experience. So patient-centeredness is another important facet of a chronic disease prevention and management program. And I'm not sure if you're aware, but CCO launched its new corporate strategy in 2012, April of 2012. And the first strategic focus of that new corporate strategy was patient-centered care. And this is our goal. The goal is that we're going to partner with patients and healthcare providers to advance a patient-centered approach to health. To be able to do this work, we've also established a patient experience program, and there's a variety of work streams under that program, which include measurement of the patient experience, looking at patient-reported outcomes. But one of the most important things I think that we're doing that I want to sort of briefly mention is the fact that we've established a Patient and Family Advisory Council, and this is a first for CCO. And this advisory council has currently 28 engaged members that represent the entire province, so across all 14 LHINs, and they give us advice on a number of system-wide issues related to cancer. Collaboration is also key for any successful chronic disease program, and CCO collaborates with a number of different organizations and providers, and I want to mention this event specifically. So the Cancer Quality Council of Ontario, or the CQCO, we're very fond of acronyms at CCO, is holding an event, a signature event on November the 29th, that's called Primary Care Integration for Cancer, Renal, and Chronic Diseases, Improving Interaction and Transition Points Between Primary Care and Partner Providers for a Smoother Patient Journey. So the aim of this event on November 29th really is to bring together experts from international jurisdictions and talk about how to strengthen these transition points and how to encourage continual involvement from primary care throughout the entire patient journey. So I briefly kind of going over some of the work that's happening at CCO, and I just want to give you a quick summary of how it relates back to these components. So we're developing evidence-based guidelines. We're examining new models of care related to both primary care and survivorship. We launched a new focus on patient-centered care and establishing a Patient Family Advisory Council. And we're collaborating with other healthcare providers. One of the things I didn't go into a lot of detail about was evaluation, but CCO does place a really heavy emphasis on evaluation. We have a number of system-wide indicators on the cancer CSQI, which is the Cancer System Quality Index, and we look at evaluating the cancer system and identifying room for improvement. So that's another sort of piece of our program. I try to squeeze a lot of information here into 10 minutes, and it just really is an overview. There's a lot of detail in terms of the work that's happening here, so I'm happy to provide you with more information or a contact who can also provide more information at the organization. So thank you for your time.